Hey guys, it's Dr. George here, and today is day 2 of the Sexual Health Conference here in Adelaide. I just wanted to report on the plenary session, and for me it was certainly an area that I'm very, very passionate about, and that is the use of information technology. What I've found has been extremely good is to reassure and see that the use of new technology has been handy in STI detection and also education. So what we're saying is that younger people are more likely to be using the newer technologies, and we're talking iPhones, we're talking video, we're talking online education content. It's available 24/7, it's private, it's interactive, and sexual content can be shared that way. And that doesn't just have to be about sexting, it can also be educational content as well. And I think it's important that we get on board here. This is a boat that's already sailing. I think we should absolutely be part of it. Other technologies that have been demonstrated is the self-check-ins. Melbourne Sexual Health is one of the leaders in this, and it's certainly a very, very useful check-in technology, because what it does is it saves time, it saves money, and it also increases accuracy. People are more likely to have the correct information in the system, which makes people contactable very, very easily. But also people are more honest when they're talking to an iPad than they are if they have to deal with the potential embarrassment of being face to face. It also saves time in appointments because the sexual history has already been taken by the computer, so everything's up front straight away. Other new technologies that are being looked at is things like being able to use prompts on clinical software, and this has been good in the GP sphere because just the inclusion of a prompt to consider testing for chlamydia has made a big difference. People who were presenting to their GP not on the intent of having chlamydia testing, but it was being picked up. So what that's meant is that there is a lot of asymptomatic chlamydia around there, and just having that prompt is picking up a lot of those cases. Other things to consider within the clinical software realm is, could you automate the processes? Say, for example, in your HIV positive patients, when you're doing a viral load, are you testing for syphilis? This can be absolutely automated, and you can opt out at any point. So it means that you can set up standardized testing, and this allows you to ensure that people are getting the optimal care that they so rightly require. SMS reminder systems are also a handy addition, and it's good for helping bring people back, whether that be for test for cure or also whether or not they need to have retesting. And people tend to opt in to get the retesting schedule done, and this has increased the uptake of earlier detection of STIs as well. There's a lot of really good resources, contact tracing, adolescent health. There's a good site called amaze.org. And also data sharing is happening as well, with the Kirby Institute sharing data as well. And I'll pop a link connected with this blog post as well. So yes, really great talk. I am all about the IT. I'm all about online education. I think this is going to be a fantastic new direction, not only in sexual health, but all health.